I'm Mike Menning, and I am working to help provide better services for people with disabilities. And basically what we're working on at this point is to visit with legislators and talk to the press about the real conditions of people with disabilities in the state of Utah. I served in Minnesota. I served in both the State House and in the Senate. And all those years, I never saw a crisis like this one. And I'm here to tell about Michael. One of the reasons why I'm here is, this might be a little unusual, but in the Bible, Proverbs 31, at the end of that chapter, there was a new king that was coming about. His name was Lemuel. And King Lemuel's mother gave him some advice. And it's listed there. One of the things she said is, speak up for those who cannot speak for themselves. Our son Michael is living in a group home. He has brain damage, and he's nonverbal. It takes a while for workers to understand him, but I'm bilingual. I speak the English language and I speak Michael's language. He makes grunts, he makes sounds, he has developed his own sign language. And as this turnover is just incredible, they don't know how to deal with Michael. And so it's so bad that our son, who is in a very good group home, they don't have enough direct care workers because they can't pay them enough. And the Department of Health, it's my understanding, sets the amount of wages that they can pay people. And people can earn far more money in Walmart, fast food, and that sort of thing. And so I see what's really happening with our son, where there are 9 clients in this particular group home, and it's been run very well in the past. But as they're competing for direct care workers, in the last month or so, I saw 3 times, I personally walked in, and I saw 3 times where there was only 1 staff person on duty, and that particular shift requires 4. And it's not because of the provider. The direct care workers have stuck with it. A couple of them have. I walked in the other night and I said, man, you look like you're tired. He said, I am. He said, I'm the only person here with 9 clients. He's got to give them the meds. He has to take them to the bathroom, which they have found a solution because it's impossible for them to take proper care of our son. And they now have put diapers on him. And it's like putting diapers on anybody in this room, because Michael knows how to go to the bathroom, but he just needs some help. But it's because of the policy of this state. That's where it's all at. And the state-run organizations, the Developmental Disability Center in Provo, the state hospital, they have increased the direct care workers' wages to $17.50, and they refuse to do it for the vast majority of handicapped people in this state. In this state, I see the legislature is bragging about the fact that we have a surplus and they want to give a few bucks back to the people. We need to speak up for those who cannot speak for themselves. This is the biggest crisis and inhumane thing that has ever happened in the state of Utah. And so I just want to say to the people of this great state, and I want to say thank you to the media for bringing this message out. I really doubt that our policymakers are such bad people. I think it's simply because they don't know. I'll give them the benefit of the doubt.